The webinar will begin shortly. Please remain on the line. The webinar will begin shortly. Please remain on the line. The webinar will begin shortly. Please remain on the line. The webinar will begin shortly. Please remain on the line. The webinar will begin shortly. Please remain on the line. The webinar will begin shortly. Please remain on the line. The webinar will begin shortly. Please remain on the line. The broadcast is now starting. All attendees are in listen-only mode.
Good evening, ladies and gentlemen. My name is Dr. Jeffrey Woods, and I want to welcome you to the neighborhood meeting for the SCL Lutheran, now Intermountain Health, and Acadia Healthcare joint venture project that is planned for Westminster. We're going to share this evening with you some welcoming remarks. We'll have a question and comment format, applicant presentation that will involve a project overview and site plan, and discussion regarding the architecture. And then Amy Johnson, who we want to give special thanks to as senior planner for the city of Westminster, and her team will take over and provide some additional information related to development and review process, standards of approval, and then we will have questions and comments for the audience. So I want to thank you again for your time today and this evening, and I'll turn it over to Amy Johnson for some comments.
Thank you. Hi, I'm Amy Johnson with the City of Westminster. I will be your main point of contact with the city for questions related to our process at the city and what this project will be subject to. I would like to just explain that at this meeting, we hope to gather your input at this early phase in the development process so that the applicant can implement changes to alleviate any concerns you may have. If you have a question or comment, please do type it into the question box as shown on the screen here, hopefully on your screen as well. At any time during the presentation, you can type a question or comment there. Note that if you are logged in on a cell phone or tablet, they will not allow you to speak aloud or be on screen on camera, but you can still enter questions into that box. If you have technical difficulties asking a question during the meeting, please email me at the address that we will show at the end of the presentation, and I will get you a response as soon as possible. After the presentation, your questions that you enter into the box will be read aloud along with your name and will be included in the recorded version of this video on YouTube for others to watch. So that we can make efficient use of everyone's time, if you have questions about subjects unrelated to this project, please email me and I will route your question to the appropriate people. And again, I will provide my email address at the end. If you would like to state your question or comment aloud, please type into the same question box, "I would like to speak," and the staff member will let you know if or when you are able to speak after the written questions and comments have been heard. That's all for now for me.
All right. Well, thank you, Amy. I appreciate the information for our audience. Again, my name is Dr. Jeffrey Woods, and I'm the Operations Group President with Acadia Healthcare. We are very proud and pleased to be partners with SCL Intermountain Health in the development of this new behavioral health and substance use disorder hospital with the plan to have that hospital located in Westminster. With me today, I have Mark Luttrell in the room. He is the Chief Executive Officer for this project. Greg Moss with the SCL Intermountain, who is the VP of Communications and Community Relations. Megan Durning, who is the VP of Strategy and Business Development with SCL Health. Brad Lipsey, who is the Civil Engineer with Crunk Engineering, who is working on this project. And Chip Hill, our architect, who has assisted with the design and will continue to work with the design team for this project. Next slide. So we have a brief vicinity map here that identifies the location of the project. And as you can see, it is located between West 116th Avenue and Huron Street. And the project site is identified by the word project site. And so you can sort of see more broadly where the project will be located. As we go a little further into the presentation, our architect Chip Hill will give a little bit more information about the location and the design of the proposed hospital. Next slide. So the relationship between Acadia and SCL and our partnership began in December of 2021. SCL Health went through a very diligent process to identify a national provider of mental health and substance abuse services to partner with to bring these new services to the greater Denver market. And I think importantly, when I say new services, I think it's important for you to know that these aren't exactly new services. It will for sure be a new hospital, but SCL Health and now Intermountain Health, they have a very long tradition, about 33 years of providing exceptional mental health and substance abuse services at their campus, West Pines, located in Wheat Ridge. And that campus will be closing along with the main Lutheran Hospital campus as they have built a replacement hospital at another location for the Lutheran Medical Center campus. And the location we chose in Westminster was intentional and deliberate based on demographic analysis of where patients most likely are going to be able to access care more readily, proximity to area emergency departments and medical practices, as well as ease and convenience for both citizens and family members to be able to access the hospital and to be able to come and be part of the treatment process and care of their family members while they are in treatment at the hospital. The purpose of this partnership is to increase access to psychiatric care for residents of the Denver and metro area. And our partnership was really formed from a position of aligned missions, and that is to improve the lives of the communities that we serve. Very briefly, Acadia Healthcare is the largest provider of mental health and substance abuse services in the United States. We operate more than 238 treatment facilities in 39 states and Puerto Rico. And on any given day, we have 70,000+ individuals who are receiving care across the country in treatment centers that we operate in. We are just deeply proud and honored to have the opportunity to be of service to Denver and the greater metro area, and to be partnered with such an extraordinary health system as SCL and Intermountain Health. Next slide. So when we think about need and why there is a need for the hospital, the why for this hospital, there are some statistics that I wanted to share with you that I think help to describe that. Nearly 1 in 5 adults has a mental health need, and in Colorado, that represents more than 1 million people. Nearly 1 in 5 young people in Colorado stated they had seriously considered suicide in the past year. And only 48.8 or 44.8% of adults report receiving mental health treatment, despite the fact that there are so many more who require it and need it. And that is a function of a lack of access to care. There are certainly some issues related to stigma around mental health, which is a huge issue. We have to reduce the barrier for stigma so that people in need of help can gain access to help. Shockingly, suicide is the second leading cause of death amongst Coloradans aged 10 to 44. And unfortunately, Colorado exceeds the national benchmark for suicide, and making access to treatment vital to our community. Next slide. So again, on the issue of need, there is an analysis that is performed at the state level. There's an analysis that is performed by our company and other companies to try to determine how many beds are really required within a community to meet the mental health needs of that community. And that analysis was performed for Adams and Jefferson County and did contribute to our decision on the location for this hospital. And for those two counties, there should be approximately just under 1,100 psychiatric beds to meet the needs of behavioral health and substance use disorder patients in those communities. Presently, there are 505 beds in the community to meet that need. So really representing a deficit of almost 600 beds across Adams and Jefferson County. This new hospital, while it is a new hospital, it is really the replacement hospital for the 33-year-old West Pines Hospital, which has done just such a terrific job and contribution to the community over the last 33 years. Next slide. So I want to talk a little bit about what this hospital will treat, but I also want to talk a little bit about what this hospital will not be treating. The hospital will, as a behavioral health hospital, we will be providing care for individuals who have what we call general mood disorders. So things like depression, anxiety, bipolar disorder, or have experienced some traumatic experience in their life that has made it impossible or more challenging for them to be able to engage in the normal activities of living that we all get to enjoy. We will also be taking care of patients with thought disorders, and that includes patients with disturbance of thought and perception or neurocognitive decline. And neurocognitive decline really sort of constitutes that class of patient who may have early onset dementia of the Alzheimer's type or other forms of dementia, some disturbance of mood and behavior. And we are able to, through the application of both medication treatment as well as other treatments, dramatically improve the quality of life of those individuals. And so we will absolutely be providing geriatric care. We'll also be providing dual diagnosis and substance use disorder treatment. care and treatment for children and adolescents in psychiatry, particularly kids who may be suffering from attention deficit disorder or who are themselves the victims of some traumatic experience, whether that is abuse or neglect or other traumatic events that may have occurred in their life. In addition, we will have outpatient services available both on what we call an intensive outpatient basis, which is typically 3 days a week for about 3 hours a day, or partial hospitalization, which is a little bit more intensive, up to about 5 days a week, 4 or 5 hours a day for patients to come back and receive ongoing care. Over time, we will have outpatient services located in various parts of the Denver and metro area to meet the need for patients where they are closer to home. And then, of course, we will have a variety of other specialty services to meet the needs of the community. When I talk about things that we don't provide, I think it's important to make a distinction. This is not a state hospital, it's a private hospital. It's a joint venture between SCL and Acadia. Patients that are seeking treatment in our hospital are patients that will have been screened to determine whether they have a significant history of violence, and if they do, that would be an exclusionary criterion. All patients are pre-screened through databases to which we have access to determine whether or not they have either state or federal criminal history, or whether or not they have a sexual abuse or sexual registry history. And if they do, those would be exclusionary criteria as well. We are not a forensic hospital, and that's important. And by forensic, I mean we are not a prison. We are not taking care of patients who are incarcerated or who are in custody with law enforcement or the judicial system. And so those are patients who would not be part of the treatment paradigm as well. I ask this question whenever I meet with individuals in groups like this. I ask them, how many of you, if you were to raise your hand, know somebody in your life, whether it is a loved one, a family member, a friend, who has suffered from a mental illness or mental distress or substance use disorder? And while I can't see a raise of hands on this video, I suspect that if we look into our hearts, we all know those people. And I want to share with you that those are our patients. Our patients are our family members. They are our neighbors. They are the people that we love and that we care about. And having access to care that is close to home, that is accessible, is so critically important to their well-being. And as you'll see a little bit later in this presentation, we purposely design these state-of-the-art facilities to ensure that we are addressing the dignity and the respect for the individuals who are seeking care within our hospital and our continuum of care across our service lines. Next slide, please. So our patients will come primarily from 2 locations, and that is going to be local emergency departments. And again, that is part of the reason for the location of the site in Westminster, is that it is geographically located such that it is relatively equidistant from the emergency department serving the greater Denver and metro area. And then our referrals will also come from other medical providers who are not necessarily in the mental health space, who are encountering individuals who are coming to their practice for general medical care, who are having a psychiatric or other substance use disorder issue that requires treatment or intervention. There will be patients over time who will come to understand that the hospital is there and may seek services individually by contacting the hospital and requesting assessments. We staff an intake department and admissions department 24 hours a day, 7 days a week by licensed, qualified mental health professionals who will be able to assess the level of care needs for anybody seeking treatment. And if it's hospitalization, then to provide that for them. If it is the need for outpatient services, then to coordinate and make the arrangements for those outpatient services. I think it's also important to note that we will not be operating an emergency department in the traditional way in which you might think of an emergency department. And that's important because this is a quiet hospital. We do not have lights and sirens and ambulances that are screaming up and down the streets of our property. When patients are transported to our hospital, it's done without the benefit of lights and sirens, and it's a quiet experience for the patients. Whether they're transported by ambulance, whether they come by family members, it's a quiet experience. Next slide. When patients are admitted to our hospital, they will receive comprehensive care and treatment by a multidisciplinary team made of medical professionals, and that will include psychiatric physicians, nurse practitioners, primary medicine and specialty physicians, registered nurses, social workers, therapists, counselors, adjunctive therapy providers, case managers, and other specialty providers that will meet the unique needs of the patients. Our obligation in providing the care through this hospital is that we will do so such that we are providing care for the whole person, mind, body, and spirit. We will be meeting the obligations and commitments that SCL and Intermountain have made to this community with respect to our charity care policies and the way in which the hospital operates as a good neighbor and as a neighbor who is going to take care of those individuals who need services, regardless of their ability to pay, and certainly for the benefit of the community. Patients will engage in structured group and individual therapy activities throughout the day. It's a very structured program. It is tailored to their unique needs and diagnosis so that we're certain that we are meeting the critical threshold needs that these patients have when they are in the hospital, but then the skills that they're going to require in order to be able to remain out of the hospital when they are in outpatient services at their home provider. Every patient who's admitted to the hospital is discharged with a complete, comprehensive, and safe discharge plan. There is not a single patient ever that will be released from the front door of the hospital and told, good luck, we hope things work out for you. Every patient who's discharged will have a comprehensive discharge plan, a comprehensive medical plan if necessary for follow-up, and a comprehensive psychiatric plan for follow-up. And we will arrange those follow-up appointments, and we will ensure transportation from the hospital to their home or wherever the next level of care is that the patient may be going, whether it's a nursing home or some other location. So no patient walks out the front door of the hospital and is left to the street. That will not happen. We have a very secure facility. You'll hear a little bit more about that in a little while, but I did want to share one example. We have a technology called Observe Smart that will be deployed at this hospital. It's a very simple wristband that looks like a Fitbit, and it's attached and it's non-tamperable, so the patients can't remove it. It's taken off with a specialized tool at the end of hospitalization, but it's programmed upon admission so that we know at all times where that patient is within the hospital. And the hospital has concentric rings of security so that patients cannot freely come and go either from the unit that they're assigned to or from areas of the hospital. And if they step out of one of the areas for which they are approved to be in, then it sends an alert to the staff, both on iPads as well as to the nurse's station, that the patient has gone to a location that they were not authorized to go to, so that they can quickly be retrieved, brought back to the appropriate space. And some of this is to keep patients from doing things like going into another patient's room, for example, where they ought not to be. So it's a wonderful technology. I don't have time to sort of go into all of the details, but it is absolutely amazing and incredible. It also has biometrics that will help to ensure that we know that the patients are safe and that we have good signs of life at all times with the patients that are in our hospital. Next slide. So as a good partner in the neighborhood, and this is not an exhaustive list, but we will be partnering very closely with the Chamber of Commerce, Rotary clubs, the schools, a number of other civic organizations, with law enforcement, with first responders and EMS. We will be offering school programs to teach both the counselors and to educate and support the counselors and teachers on suicide prevention training and resources, referrals and treatment resources. We do a tremendous amount of work across the country and hope to be able to do so here with veterans and military members. I'm myself a former Army captain, and so I have a deep appreciation for services that are tailored to the needs of the military community, and both active duty, retired, or those that are the dependents of military service members. We also have, again, close relationship with law enforcement, with the crisis teams, and with the community mental health services and centers. Over time, we expect that our services will grow so that we are contributing in a very material way to general population health. The goal is that the hospital should not be the first choice of treatment. It should be the last resort of treatment. But of course, there are so few services available anywhere in the country, and equally so in Colorado, that we look forward to being able to contribute to growing an ecosystem of mental health services in collaboration with all of the existing wonderful, fine providers in this community to contribute to the health and welfare of the community. Next slide. And at this point, I will turn over the conversation to Chip Hill, the architect, who will describe more about the project.
Good evening. We'll take another look at the vicinity for the project. Per the site map that's on the screen, the project site is located at the intersection of Huron and West 114th Avenue. And specifically, the entry drive for this site will be directly across from, there's an auto care center that's right across Huron from the property that's north of 114th Avenue that will serve as the entry. The overall site's approximately 11 acres. I will note that the proposed hospital use is consistent with the comprehensive plan for Westminster, and the site is zoned PUD. The preliminary development plan amendment that we are seeking proposes to add hospital as an approved use. Next slide. A little more information on the surroundings of the property. Tri-State property is directly to the north of us. To the west, there is a large open space undeveloped at this point. To the south, we have the Kaiser facility, but in between that and this hospital, there is open space that Tri-State is working with the city on. The city will be purchasing that open space, and it will create a pedestrian connection between Pecos and Huron streets as a community element. The overall facility in terms of the scope of the project, 144 beds, 2 stories, roughly 99,000 square feet, 195 parking spaces will be provided on the site. We anticipate construction will start in the first quarter of 2023 and an estimated completion and open date in the second quarter of 2024. The economic impact for this project is approximately $30 million annually, and that is because of salaries, wages, benefits, and this is a tax-paying entity for the city of Westminster. And overall employment will be approximately 265 full-time employees, everything from doctors, nurses, techs, et cetera, for the community. Next slide, please. Jeffrey talked earlier about the safe and healing environment. It is first and foremost a state-of-the-art purpose-built facility. It is controlled access in and out of the facility and internally between nursing units. Patients simply cannot walk out the front door of this facility. We do have exterior activity yards as an amenity to the rear of the facility, and they do have 14-foot exterior fencing for that. We have 24-hour video surveillance of the lobby, outdoor, and common areas, and as Jeffrey mentioned, regular patient checks as well. But bringing that back to the dignity of the patient and the mission of this facility, the main point here is that it is intended to be a therapeutic environment for patient care, calming, soothing finishes throughout, generous use of natural light, and a variety of activity spaces for a heavily programmed day for the patients when they're in the facility. Next slide, please. This aerial view, you can see the Tri-State property to the right of this. To the left is the green space and the open space that the city will be acquiring. We have parking in the front of the facility, all visitor and public parking there. You can see the main entrance canopy in the upper right-hand corner of the facility, and then a little further to the right is our patient transport entrance, and to the left side is the loading dock for the facility. Next slide, please. A little bit of information on exterior materials. The exterior is a combination of stacked stone and ephes or stucco finishes. We have metal panel accents along the front of the facility and a precast screen wall system along the rear of the facility as well. Next slide. A couple of final views of the facility. It is, once again, it's 2 stories compared to, for instance, the Tri-State facility to the north is 4 stories. So this will be a very low and quiet neighbor in the community. We'll have certainly comply with all of Westminster's requirements in terms of light spill off property. This will be a good neighbor for the community. And with that, I'll turn it back over to Amy.
Thank you. So again, if you have a question or a comment, please type it into the question box at any time during this presentation. Note that if you are logged in on a cell phone or tablet, this is something I said at the beginning, but in case you're joined us after that point, cell phones and tablets will not allow you to speak or be on screen, but they will allow you to enter questions into the question box. It's something that like what you should see on the screen here. If you have technical difficulties asking a question during this meeting, please email me, project planner. I'm the main point of contact at the city, and I will respond as soon as possible or get someone else to respond as appropriate. After the presentation, your questions will be read aloud along with your name and will be included on the recorded version of this video on YouTube, so that we can make efficient use of everyone's time. If you have questions about subjects unrelated to tonight's project, please email me, and again, I will either respond or route it to the appropriate party. If you would like to state your question or comment aloud, please type "I would like to speak," and staff will let you know when you may speak. But we will address all the questions typed into the box first before opening the meeting to live speakers. So again, I am Amy Johnson, Senior Planner, your main point of contact at the city for this project. A couple of reminders. Again, you can enter questions and comments anytime throughout this presentation, and the whole meeting is recorded and will be uploaded to YouTube afterwards. This is an outline of the review process that this project is subject to with the city. As you can see, both the preliminary development plan, or PDP, and the official development plan, or ODP, and these are both amendments to those, have completed their initial round of review, bringing us to this project meeting. We have these meetings early on in the process to ensure that the neighborhood input can be incorporated before the next submittal and before our next review. Once our review is complete, the PDP amendment will go to Planning Commission and then City Council for the final decision on whether to approve it or not. As long as the ODP continues through this review process concurrently as it has started out, with the PDP, it will also be seen by both Planning Commission and City Council at the hearings with the PDP. If it is approved, if both documents are approved, the applications for construction drawings and building permits will be reviewed and approved administratively once they are found to comply with the approved ODP, PDP, and all relevant requirements. Section 11.514 of the WMC, or Westminster Municipal Code, establishes 10 criteria that shall be considered for approval of amendments to PDPs. A cross-departmental team of city staff ensures that these standards are met throughout the development review process, including things like land use conformance with the comprehensive plan, application of sound planning principles, compatibility with surrounding development, protection of existing land uses from adverse influence, no adverse impacts on existing or future land uses or development, and safe and efficient design of transportation infrastructure. Section 11.515 of the Westminster Municipal Code establishes 17 criteria that shall be considered for the approval of amendments to ODPs, including reviewing things like parking spaces, stormwater drainage, pedestrian connections, landscape, outdoor areas, compatibility of design with the surrounding area, conformance with the comprehensive plan and all city codes and ordinances, and consistency with the approved preliminary development plan. This concludes the presentation portion of the meeting. We will now go through the questions and comments that have been entered into the question box. Please feel free to continue adding questions or comments as we begin to do that. And as we near the end of the meeting, I will proceed to the next slide, which will display contact information for both the applicant and the city, me. So with that, I will turn it over to John McConnell, who will read us any questions that have been entered.
All right, thank you, Amy. There's only one question so far. It's from Christine Karowski. The question is regarding, quote, partial hospitalization. Will patients be likely to wander around the neighborhood before or after their daily treatment? meaning are all patients transported between their homes and hospital?
So, Megan, you got okay. Oh, are we open? Okay, very good. Thank you for the question. This is Dr. Woods. Patients participating in partial hospitalization or intensive outpatient will be transported to the hospital and home by the hospital. However, there are certain patients who have the ability to transport themselves, to bring their own vehicle, and they are sufficiently stable, elsewise they would not be in the program, who will come to the program, and they will leave the facility when the program is completed for the day. These are high-functioning adults, generally, and I'll just tell you very sort of broadly, significant portion of our patients are professionals who have life events that have caused them to be in some distress. Once they are stable and are able to participate in intensive outpatient partial hospitalization, it would not be unusual for them to drive themselves to the hospital and then drive themselves home at the conclusion of their outpatient encounters for the day. They will not be loitering around the hospital. We do have security we will have security at the hospital, and we won't be allowing loitering at the hospital or the neighborhood. We don't have that issue at any of the hospitals that we operate across the U.S., and I don't expect it here, nor do we have those issues at West Pines where these same services are provided.
All right, thank you. The next question is from J.D. Matella. The question is, can there be a stone wall built along the south edge of the property near the loading dock to help block noise that would carry into Westbury Farms at Apple Valley North?
Thank you, JD. The simple answer is we will take that under advisement, and I will have our architects and our engineers evaluate that as part of the design element. I don't have any immediate objections or thoughts why that cannot occur, but I will defer to our architects, engineers, and then of course the city planners with respect to that decision. But as the operator who's in charge of this project, I can tell you I have no objections to it.
Thank you. There are no further questions at this time. I would encourage anybody in the audience that would like to ask a question, please consider entering your question at this point, and we'll give everybody a few minutes. If in a few minutes we don't hear or see any questions, then we'll move to begin closing the meeting.
And hopefully everyone knows where that question box is now, so that you can go ahead and enter any questions or comments that you might still have that you haven't quite had a chance to enter in. However, I thought I would go ahead and show you some of the contact information that we have available for you and show it long enough that you can write it down if you need to. The main point of contact we have for the applicant is Michael Shaw. We have his email address there and his phone number. The project owner is Tri-State Generation. We don't have contact information there for them right now because we believe that the project applicant and the city should be able to answer any questions. But if you do need to contact them for any reason, please let us know. Let me know. This is Amy Johnson again. And my contact information, of course, is below that. I have my email address and phone number as well. And then again, if for any reason you need to refer back to the recording of this meeting, we do have the link here, youtube.com/user/westminsterco/videos. And that should be uploaded within about 3 days after this meeting. In case you're looking too soon, it will be coming probably within about 3 days. And finally, we do have the development status webpage shown here. That is a bit of a long link, I know. If you don't manage to get it written down, again, you can always email me, contact me, and I can give you this link as well so that you can keep on tabs on this project if you would like, and other projects that are happening in the city.
All right, we do have an additional question from Sandra Vintage. The question is, please explain again where the open space walkway between Huron and Pecos will be. Sandra, I don't believe we have anybody on the call tonight from our Parks, Recreation, and Libraries Department.
John,
Amy,
I'm prepared to just generally speak to that, if I may.
Sure, please do.
I've been speaking and coordinating with our contacts at the Parks, Recreation, and Libraries Department regarding that. Let me see if I might go back here. Well, I have some notes here, at least, that I can refer to. They are planning to put it in that open space. I can't tell you exactly where. I'm just going to go back to the site plan that was right here. So just to clarify, they did mention this in the presentation, but this is part of approximately 12.6 acres that the city is under contract to purchase. So that's why this property line is here instead of down by the Kaiser project down here. The trail is meant to go through here, and I'm told that the intention is to make that a part of the 2024 capital improvement project proposal. So that those funds are not exactly spoken for yet, but we anticipate that that should hopefully, start in the next couple of years. Also, just to clarify, to the west here, this area is not zoned as open space as opposed to this part down here, which is allowed to be open space. So we're not sure what will happen over here, but it is not zoned to remain open. It could have residential, or it could potentially have commercial or office developments on it.
All right, thanks, Amy. There are no further questions at this point. Again, we'll give folks just a couple more minutes before beginning to wrap up the meeting. All right, Amy and the applicant team, I think it's probably safe to go ahead and begin closing comments. I see no additional questions or comments in the box.
All right, thank you, John. I already, spoke about this contact information and so forth. So I have no further comments. Thank you for attending tonight, and I'll let Dr. Woods close us out if he has anything else he would like to say.
Thank you, Amy. And once again, I want to thank you and your staff and the folks in your office for your assistance this evening and for your work towards this project and the improved health that it will bring to the citizens of Denver and the larger Denver metro area. We're very enthusiastic and excited about bringing this project to life and to be of great service and good neighbors to our friends in Westminster and more broadly across Denver. So thank you again for your time this evening, and we look forward to the continued collaboration. Be well.